What's up, you guys? It's your boy Miguel giving your daily dose of radiation. In today's video, we're covering what is the differences between being a emergency room X-ray tech versus if you work at an orthopedic and you do X-rays there. So they both do X-rays. They both dabble in the majority of the same things, but it kind of varies. Okay. So, a lot of the time in the orthopedics, you'll have a lot of spines, a lot of extremities. You already know that is your bread and butter in your departments, and probably some chest x-rays for pre-ops and stuff like that. Majority of the time, that is what you will be doing. You'll be doing all these special angles that maybe when you were an X-ray tech student or you're currently a student, you're like, where would we do this kind of very niche angle? Ortho. The orthodox will order these, because if you're like, Miguel, can you give me a Gracies? And you're like, a Gracies? What? We just do AP, internal, external, and why? No, I want a Gracies. A little different. The little different exams or different names, or they'll have like old school names. Some of them too. A little different. Or obliques, like especially like where I work at for L spines, it's just an AP, a lateral, a spot. That's it. Ortho, you'll want the obliques, which it's not really hard. It's just like 2 more extra pictures. So with everything. So they do a lot of obliques. They do a lot of the special views, like I said, like the inlets, the outlets, the SI joints, they want to see the little gap joints open, the standing foot. Like some of them were like they want to see the joint space, so like they'll hold like some weights or they'll hold something to get like the joints down. Like all these various little different nifty tools. Like they'll do they also in certain places where there's techs who actually are in the OR, they'll be doing the fluoroscopy with the C-arm, and you'll dabble in whatever stuff they're replacing with, which I'll make another video on that. But as far as just basic x-rays, they do a lot of views. Like maybe certain ones will do like the tunnel view instead of like just the patella, the sunrise. They want the little tunnel view, so you do different angles and different stuff like that. Versus like where I work at in the emergency room, night shift, it's just like basic, just straight, the basic stuff you learned at X-ray school. That's kind of what we do. Occasionally, depending on how something is broken or maybe certain ways the position the patient is, you may have to cater and whoop out different views to acquire this. Like if you did work in ortho, I had a tech who worked in ortho and they whooped out some of the views, which is, once again, it's acceptable to do those views. You maybe have to annotate it that you did it a little bit different, but it still gets the job done. It's nice to have different techs work with you who've been in different places, because maybe in your little brain you see something, you're like, oh, this is how we always do it. This is how I know how to do it. And then someone's like, hey, what if we do it like this? And you're like, I ain't never done it like that. But then they shoot it and they're like, same thing. So it's always nice to have, a different eye, have someone with other experiences. Because once at the end of the day, if you're with your team, well, as long as you're able to get the images done to the best of the ability and with the Alara, you're able to get the job done, But majority of the times, the biggest difference, a lot of extremities, a lot higher pace in the ortho center from what I've noticed. A lot of the patients will either be coming in because their stuff is broken, coming in because post-op, so they have like their metal rods, their Terminator situation going on, and like they're looking at it, or maybe they got hurt and they're trying to see if their stuff got damaged, which, I mean, in the emergency room we still get those too, but usually what happens is they come in and then their stuff get broke, and then they reach out, they're like, hey, your stuff broke, you're gonna have to reach out to your orthopedic, or we're gonna keep you here and then we'll do surgery in the morning, whatever type deal. That's kind of what happens in the emergency room side. So Versus like in the ortho, depending how big it is, some places will be like, okay, we'll just keep you here overnight and then we'll just do surgery in the morning. Other places like, hey, just like we'll just cast it and then send you home and then come back so many days and then we'll do the surgery. It all kind of depends on that. And yeah, it's been your boy Miguel. Hope you enjoyed these videos as I give you the knowledge and the wisdom that you probably won't find out there on the YouTubes. I cover very niche, specific aspects of the radiology field because I feel it is my duty to give back to the community. Because if you go on the YouTubes and you look at nursing and there's so many ungodly videos for them. What about my people? What about the people who push the buttons, the Xray techs? There's very little videos out there, so I make it my responsibility to educate the masses and give you some of the knowledge, some of the wisdom, some of the sometimes just honest truth, because some people will tell you and they'll give you like the base, the like professional view. They don't want to keep it really, like they don't. I'm gonna just keep it honest. I'm gonna keep it just straight up truthful for you, like just the truth. Maybe it's not pretty, maybe like, but I'm gonna just keep it honest with you. That is what you can expect from this channel, from all the videos I have. Yeah, it's been your boy Miguel. See you on the next one.